Good afternoon, everyone. Minister, President Duncan, colleagues, it was a privilege to work with the PSOJ and the CVSS on this very important project. It's the hardest, most complex, and most important project we've ever worked on. And it's ultimately very rewarding to see it come to this stage of fruition. What I'm going to present are the top 25 communities that we've decided to start with in terms of how we're going to go about targeting these kinds of response to vulnerable communities in Jamaica. It's very important to define what we're calling vulnerable. Vulnerability is more than poor people, vulnerability is more than old people, it's everything combined. And what you're going to see right now is that cocktail, everything put together in one place. Try to understand it here that I'm not talking maps, I'm talking models. Think about a cake. We're talking about the individual ingredients put together to create that cake. And now we're talking about the slices of that cake. Next slide, please. Next slide. So what we have are really 22 different variables put together. We're talking about poverty, unemployment, health. We're looking at physical infrastructure. We're looking at population densities. We're looking at population size. We're looking at the presence and absence of key features, health centers, hospitals. We're looking at the nature of the road network. We're looking at everything put together. We even factored in, Minister, political constituencies. We factored in whether a community is a tourism community, agricultural community, commercial community. All of those elements are put in place. We factored in whether a community is urban or it's rural. All of these different combinations result in over 28,000 combinations that can be dissected. The 25 that you're going to be seeing are the result of the national. This is the result of the model. It's a massive spreadsheet that shows 22 different economic variables, socio-economic and infrastructure variables put together in conjunction with millions of transactions from hundreds of thousands of unique locations, resulting in over 20,000 combinations and dozens of scenarios tested. What this means is that we're able to look in the tourism communities. What would happen if unemployment increased by 20% in just those areas? What would happen? How do we respond? We're able to factor in the case of political identification, you know who the MPs are, you know who the councillors are, and these guys can be the people responsible for coordinating local responses in conjunction with the PSOJ and other logistics teams. Next slide, please. So, next slide. So, ultimately, what we have would be the 25 communities, and the number one community is Linstead, St. Catherine. Number two community is Old Harbour, St. Catherine. And these models were created without using COVID case data, because the fact is that areas may not have cases of the virus, but they are suffering regardless. We need to be able to create a case agnostic system that can factor these conditions in. And when you end up seeing the top 25 communities and how many of these intersect with actual areas of COVID cases, it becomes that much more prescient that we're able to predict and therefore act in these particular areas. We factor these things here, SSP, Lindsay, and Brigadier Mason. We factor in the role of crime in all of these that underpin those underlying social conditions in communities that make a community stronger or weaker, and how you're able, through your own systems, respond to that. What you're seeing on the screen right now are the locations of the 25 communities. The areas in red are the most vulnerable communities. The areas in orange are the next most vulnerable communities. And you can see the distribution across Jamaica, and you can begin to factor in local responses in these areas. Next slide, please. What is very important is that 26 may not be that much different from number 25. So the inclusion has to be very careful in terms of how you factor in reality, logistics, feasibility of approaching 26 and not 25 or 30. Why not 45, Brigadier? And we're able to see what's going on. These are the top vulnerable communities in Kingston and St. Catherine, and again, it overlays quite well with known cases of COVID. So finally, what I'm going to show, what this thing is a product of big data mining and big data analytics. This is more than just mining an intra-organization's database or data set. We're talking about everything and everyone around us has to be captured into this total system to be able to get us information. We're seeing of the top 25, 10 of them are in Kingston and St. Catherine. Kingston and St. Andrew, with an additional 6 in St. Catherine. We see some in Ocho Rios, we see Negril, we see Montego Bay there as well. But again, this does not factor in COVID cases, it factors in absolute vulnerability. Remember, vulnerability is more than poverty. An area may be very poor or have a lot of crime, but it doesn't have a lot of people with comorbid conditions, or it doesn't have a lot of activities going on in a certain place. All of these combined is how we're able to put together this total listing of the most vulnerable communities in Jamaica. So it's very important that we have to understand that what you think is a poor area, therefore it is vulnerable, it's more than that. It is the combination of poor, unemployed, old, sick, disabled, and so on. 22 different variables put together. So as a result, we're now able to identify those areas and then begin to put numbers, populations, how do you mobilize your resources and so on. And what you're seeing on the screen right now are just maps of the individual 25 communities. That is my presentation. Thank you all very much.